Do you have type 2 diabetes? Do you worry about macrovascular disease? What's macrovascular disease? Sounds a bit irrelevant to me.
Actually, it's very relevant to anyone with type 2 diabetes. Macrovascular disease is an umbrella term for the complications of diabetes that are as a result of damage to the large blood vessels in our body. This damage can lead to reduced blood supply and clots in places like the heart, the brain and the feet. These clots can lead to a heart attack or a stroke, or problems with the feet that can lead on to ulcers and potentially amputations. So, you're probably wondering why diabetes can lead to these problems.
Diabetes is a condition that we can't see from the outside, which makes it difficult to understand what's happening on the inside. So let me explain a few things. When we think of diabetes, people usually think of it as a condition of the blood sugar, or rather blood glucose, which is understandable because that's how diabetes is diagnosed and one of the main problems with diabetes. But in some ways, it could be more helpful to think of diabetes as a disease of the blood vessels with several different factors involved, including glucose.
In type 2 diabetes, unfortunately, there's often a combination of high blood glucose, high blood pressure and high blood fats, or you might have heard of cholesterol or blood lipids. Your doctor or nurse will monitor these risk factors, but it will help if you understand them as well.
Your doctor or nurse can carry out a blood test that measures how good your glucose control has been over the last few months. The blood test showing this is called your HbA1c, and it looks at your red blood cells. In a person who doesn't have diabetes, glucose sticks to their red blood cells. When you've got diabetes, more glucose will stick to the red blood cells, and the higher your levels are, the more glucose will stick. In this model, we can see how the blood flow is much slower in someone with a high glucose level compared to someone with normal level of glucose. This slow blood flow makes it a lot more likely to clot, and it can also damage the vessel walls. On top of this, if you've got high blood pressure as well, your vessel walls are being put under even more strain, causing further damage. Finally, the third factor here is the high level of blood fats, which can then start to line the walls of your vessels, particularly if they're already damaged by glucose and high blood pressure. You can see here a build-up of fatty plaques, making the vessels much narrower. As you can imagine, this, in combination with the really sluggish blood flow, can really reduce blood supply to your heart, brain and your feet, and makes clots much more likely to form. So now we know exactly what's going on inside our bodies. It might be a big relief to know you can do a lot to help yourself reduce your risk for developing further problems. One of the most important ways you can help yourself is to make sure you have a healthy lifestyle. By lifestyle, I mean what food you eat and how much activity you do and whether you smoke or not. Eating a balanced diet that's low in salt and saturated fats and has plenty of vegetables is really important. Try to think of portion sizes when you're planning your meals, or more importantly, when you're having a treat. Work with your diabetes team when you're changing your diet so they can advise you on any changes that might need to be made to your medication.
Taking regular exercise will also help improve your blood glucose, blood pressure and blood fats. Some people find it hard to exercise because of other health problems, but exercise doesn't have to be going out for a run. Perhaps activity is a better word. Can you do some gardening or cleaning? Or if this is too difficult, even some exercises whilst you're sitting in a chair can really help. Smoking increases your risk whether you have diabetes or not, so speak to your practice nurse who will be able to support you in giving up. Care of your feet is another important part of protecting yourself. This is a whole topic in itself, so let's just mention the basics. Sometimes with diabetes you can lose the feeling in your feet. This feeling gives you some protection, so without it you may not notice if you've hurt yourself. This, in combination with the damaged blood vessels and reduced blood flow, means you're far more susceptible to foot problems. Build foot care into your daily routine. 3 simple steps are recommended. Firstly, check your feet. Look out for any redness where your shoes might be rubbing or changes in your skin condition. Secondly, wash them with warm water and soap. But don't soak them, and make sure afterwards you dry thoroughly in between your toes. The third thing is to make sure you moisturise, particularly your heels, to stop any cracks developing and dry skin. Avoid moisturising in between your toes to avoid fungal infections like athlete's foot.
Lifestyle change is the big thing that you can do for yourself, but you might also need some medication to help manage your diabetes. Keep in touch with your doctor or nurse to help you monitor your health and catch any problems early. They're there to support you, so make sure you use them.